Halt. In this half hour, we focus on the situation in East Africa. Schools in Kenya will remain closed until January 2021. Colleges and universities, however, will reopen in September with strict hygiene and social distancing guidelines. The country's Minister of Education, George Magoha, says that the East African country has confirmed more than 9,000 cases of coronavirus and 180 deaths have been recorded so far.
Schools should only reopen when the daily percentage of confirmed COVID-19 cases have reduced consistently for at least 14 days, which we call in medical terms flattening of the curve, which has just been referred to by the physician who is in charge of this process. C, social and physical distancing is actually the most critical factor in ensuring safety and health of our learners for the reopening of the learning institutions.
Well, to talk to us about education in the face of a global pandemic and the decision taken in Kenya to halt the school year, we're now joined by the country's Chief Administrative Secretary for Education, Mr. Zack Kinuthia. Thanks so much indeed for joining us and welcome to the program.
Thank you very much, Peter and Doro. And good evening to you from South Africa.
So thank you so much for giving us your time. Just how difficult was the decision for Kenya to cancel an entire school year across the board?
It was very difficult. And may I begin by saying Peter Ndoro is almost a Kenyan name?
Yes, I've been told. People speak to me in Swahili all the time.
I hope you can trace your roots back here.
Yes.
Perhaps this is your original home.
I'm sure.
Taking this decision was monumental risk, yet it was unavoidable. I can tell you we had to go back and forth for a long period of time before we could agree. All the stakeholders met for a long time. Gridlock after gridlock. Disagreement, sometimes becoming bitter. Pressure coming from various sectors of our economy, from the parents, others from business people, from stakeholders that are of trade unionist nature. We had to grapple with the ramifications that follows up such a critical decision that will affect not just the education of our children, not just the economy of privately owned institutions, but also the health and the life and the safety of the children. Therefore, I can tell you, this is a decision that at the time of making it, we declared that whatever we are going to announce to the press and to the people and to the world is what we call a catch-22 situation, where if you do, you are damned. If you don't, you are doomed.
Yes.
And that is what we had to go with.
So what was the tipping point? What was the thing that finally said, we have no choice, we must just do this?
Thank you. That's a very good question, because part of the people who have not understood why this one had to be done did not consider the question you are asking, Peter. And I'll answer your question straight and tell you that the tipping point was simple. That the sole and solemn mandate of any government under the sun is to protect the property and the lives of the people. For us, our priority was the health of our children. And this is what we said. If one child were to get infected and succumb, the hit that would be turned by the masses would not be on teachers, would not be rather towards us. It would be hit turned towards His Excellency, the President of the Republic of Kenya, who is a Pan-Africanist, Honorable Uhuru Kenyatta, would carry the burden of the death of a child. And we agreed because WHO has estimated, especially for us under the tropics, this disease will climax at the end of August, all the way to the beginning and the middle of September. And this is when it shall hit our people the worst. So, thinking that this is a tipping of the curve, we would not allow our children to go. Because you cannot control children, Peter. You can control adults and younger people. but you can't control children. Class 1 or grade 1 all the way to grade 8, junior and senior secondary school, it is not possible to regulate them, even under enhanced protocols of health as advised by WHO. So the tipping point for His Excellency the President, and he advised us and followed us almost every day. He said, whatever you do, save the lives of our children. Those are my daughters, those are my sons, and if any would succumb out of your recklessness, I would have your head in the chopping board. That is why we decided to take the decision as we took.
All right. And is that why the colleges and the universities remain open? Because these are adults?
First of all, that would be one reason. But above all, the best of the reasons why we want tertiary institutions to reopen, they are not reopening in the 1st or 2nd or 3rd or 4th of September. We say it shall be phased reopening. From the word phase, let it be staggered reopening, because their curricula first is not administered uniformly. Secondly, we believe that this, and we know that these tertiary institutions have a way of maintaining the protocols as has been set to globally. That is social distancing of 1.5 meter. Secondly, they can maintain themselves by applying their rationale and logic to take care. As long as these institutions can have water that is flowing and soaps, as long as they can have sanitizers dispensed at various places, as long as classes can be faced at 1.5 meters, whichever institution, could it be Village Polytechnic, could it be Technical Training Institute, could it be a National Polytechnic, could it be teachers training colleges and our universities, public and private, once they are ready, they will obtain concurrence with the Ministry of Education, where we are serving, and we will inspect ourselves and allow them to reopen as when they are ready. Could be September, could be October, could be November, could be December. I mean, if they are not even ready by December,
then
they will reopen when they feel they are ready. As much as they are adults, we also want them to be safe.
What do you make of the science, the scientists suggesting that children are less likely to be hospitalized, taken to intensive care, or even die from COVID-19? Somehow, for some reason, children seem to be more robust with this COVID-19, so that taking them out of school perhaps is an overreaction.
First of all, it is true that COVID-19 is not taking a tall order on children and teenagers and young adults. That is true. I mean, the scientific research that has given us this data tells us so. However, Peter, even children are dying. Here in Kenya, we have been recording even deaths of infants. We have been recording deaths of teenagers. Just today, the government mourned the death of a frontline soldier who is a doctor today, and she was a woman of late 30 years. She wasn't an old lady to die, nor a very young person to die, but it is what we would describe a person of an age where coronavirus cannot kill. But she died today, and she was just caught up. Yesterday, a taximan driving his car, a man of 33 years, dropped dead, and was, later found out that it was coronavirus. What these people are doing, the one you are mentioning, the schools, these children are not immune to the attack of the virus, but they are asymptomatic. They can carry the virus and you cannot know. You cannot tell. And that one facilitates infections to many people, what we call en masse infections to people. The more this virus gets into the younger people, if they are susceptible to preconditions of medical preconditions, or even worse, if they get flu that is normal out of cold or out of dust or allergy, any allergy, they can fall, because coronavirus is death in waiting. Any weakness towards the immunity of these children will take them down. We have seen it happen in your country. We have seen it happen in Denmark. We have seen it happen in Italy. We saw it happening in some parts of America. Children are allowed back, then they succumb. We saw again that in South Korea. We saw it. Children coming back, reinfections getting up, and then these children getting infected and suffering more. Finally, Peter, in terms of this question you are asking, our greatest fear again on exposing children to en masse infections is easy. These children will go back home. And whom are they going to meet, Peter?
Their
they are going to meet their
their grandparents.
And then they are the grandparents. Now, the moment a child hugs a father, a mother, or a grandparent, or even a kin, they will infect that virus and kill their children dead. We envisaged in our greatest fear of thinking a country of young people without their parents and older relatives because they have killed them. We said the day you hug your grandmother, your grandfather, your mother, your father, you are sending them to the grave. You may not die, and it is true you will not die, but you are sending them to the grave. Our president gave an example in a televised debate and said that his son had also gone out and he thought that he had been reckless by partying. And then he was asking his son, you know, if you come and hug your grandmother, then you expect to infect her. Think and know how to live with yourself. I mean, it was the best example for the nation because it was straight coming from his family and telling us that even his own children are not allowed freedom to be reckless and infect the older generation. So for us, besides many things, we're also thinking about social posterity of our societies.
Okay.
We do not want to kill our parents or our grandparents because of being reckless and pursuing knowledge more than pursuing the health of the nation.
Okay, so you've laid a good argument for why you took this decision. We're going to take a quick break, and then when we come back, we'll explore some of the possible consequences of the decision that you've made. Please stay with us.